Duchenne muscular dystrophy and caregiver's burden in DMD. In this video, we'll learn about the basic causes and symptoms of DMD, as well as caregiver's burden in caring for a DMD patient. So what is DMD? Duchenne muscular dystrophy is a genetic disorder mainly affecting boys that leads to progressive muscle degeneration, damage, and weakness. This muscle weakness begins early on in childhood, near the ages of 2 to 3 years old in the muscles near the core of the body in the shoulders, thighs, and upper arms. These symptoms progress towards the heart and respiratory muscles later on in life, possibly leading to the development of cardiomyopathy and acute respiratory failure. DMD is caused by mutations in the DMD gene on the X chromosome that creates the protein dystrophin. The dystrophin protein is primarily located in skeletal muscles and cardiac muscles and exists as part of the dystrophin glycoprotein complex. The dystrophin glycoprotein complex anchors the cytoskeleton in the cytoplasm of the muscle cells to the extracellular matrix, providing stability and protection to the muscle fibers. When the DMD gene is mutated in a way that leads to an absent or non-functional dystrophin, the dystrophin glycoprotein complex is lost, resulting in a loss of stability in the muscles and vulnerability in the muscles to contraction-induced injuries and damage. Typically, DMD boys continue to experience progressive muscle weakness to the point of losing ambulation at around 12 years of age. At this point, they require the regular use of a power wheelchair and require assistance or mechanical support for any activities involving the legs or trunk. Living with DMD must be carefully planned ahead of time so that medications, screenings, and care are properly received and at the correct times. In regards to care, there are many different kinds of care that is required for treating DMD patients. Muscle and joint care often requires neuromuscular specialists and physical therapists to determine efficient stretching routines and methods to keep ambulation for as long as possible. Heart care requires regular heart screening and tests such as MRIs or echocardiograms to be able to detect any abnormalities or changes in heart function and structure. For lung care, pulmonary function tests should be taken once a year to be able to monitor breathing ability. In some cases, patients experience nocturnal hypoventilation, requiring non-invasive ventilation to help with breathing during sleep. Other factors such as mental health and learning must also be carefully considered for patients with DMD. Many of these described forms of care require the assistance of caregivers to provide the care or help transport the patient around for testing and screening. These caregivers, who are often the parents or family members of the patient, experience something known as caregiver burden throughout the many years of taking care of someone with DMD. So what is caregiver burden? Caregiver burden can be explained as the stress experienced by the caregiver due to the experience of providing care itself. This type of burden is common among caregivers of people with terminal diseases or disorders, and many factors may contribute to the buildup of this burden. These factors can include things like financial burdens, care costing too much time and energy, or sadness over the fate of the supported individual. So why is studying caregiver burden important? Well, studying caregiver burden is important because it has actually been found to impact the health of the caregiver in various ways. One study conducted in 2018 used data from assessments of the mental and physical health of DMD caregivers to find that caregiving in DMD was frequently associated with negative outcomes such as poor sleep quality, reduced family function, depression, pain, and stress, as well as a considerable impact on work life and productivity. In another study conducted in 2014, they found that DMD caregivers' health expenditures were 7 to 16 times higher than the average of their respective countries, with this financial burden increasing along with disease progression. In these studies, various interviews and assessments of mental and physical health were used, such as the Zarit Burden Interview and Euroqol 5D test, to determine how caregiving has affected the health of the caregivers. Now that we've learned a little about caregiver burden in DMD, let's see how this form of stress may arise for Harvey as he takes care of a boy with DMD named John.
Harvey was assigned to be the caretaker of John when John was assigned to a wheelchair right before his 12th birthday. This was the first time that Harvey had been assigned to be one of the sole caretakers of a DMD patient, so he was unaware of the toll that this job would take on him. However, Harvey had a good heart and wanted to help this child and his parents as much as possible. John was still being prescribed his normal corticosteroids to maintain his upper body muscle strength, and Harvey had been instructed by John's doctors to make sure that he stretched each morning and evening, and to take him for a light swim every day. Since John's family did not have their own pool, Harvey took it upon himself to bring John to his local community pool every morning. After 6 months, John lost all function in his arms. However, Harvey had stopped taking John for his morning swims 3 months ago, since John had started getting sick very often. This was a potential side effect of the steroids that John was taking, but being around so many people and germs at the community pool definitely took a toll on John's immune system. Harvey had still been instructing John through his morning and evening stretches, but after losing function in his arms, John could no longer stretch either. While Harvey had always known that this was bound to happen, it pained him to see John in such a vulnerable state. He knew that the stretches and swimming that he had taken John through had helped him to be in as good of a condition as he was at the time, but it hurt to see that despite all the effort he had given to help John, most of it would end up doing nothing, as John's fate was already decided. 5 years later, John was in line to get his own cough assist device. In the last 5 years, Harvey had not only gone much closer with John, but also his parents, and Harvey witnessed everything that his parents had to go through to ensure that John got his treatments and professional care. John did not come from a very wealthy home, and so Harvey often overheard the difficult conversations that John's parents had with their insurance company about John's treatments, and now the expensive cough assist device that John needed to survive. The economic toll that this took on John's parents had forced his father to work longer hours at his job, and had also forced his mother to get a job 2 years before. Getting so close with John's parents and knowing how much they were both going through, Harvey also started to feel the effects of the burden that was placed on them as caretakers, and he had experienced many sleepless nights over the past year. He knew that he was caring for a child who was destined to die in the next few years, and that pained him, and he could not even imagine how much pain his parents must have endured knowing this was happening to their own child. 2 years later, John had to be taken to a more advanced care facility as his lungs started to fail and he needed help breathing. While Harvey did not need to be there for John anymore, John's parents implored him to continue to be there for Harvey when they couldn't, and Harvey couldn't decline. He shared a special bond with John now, and he couldn't just leave John now in his moment of need. However, while John's body started to deteriorate more and more, Harvey's mind started to undergo a similar process. For the past year, Harvey had been seeing a psychologist to help him deal with the depression he felt when thinking about John. He felt like his job was futile, since no matter what he did, John was going to die anyways, and that is a depressing thought to have. Harvey also found that he was spending less time with his own family and friends, and even when he did spend time with them, he couldn't get John off his mind. Harvey had started to see John as his own son or nephew, and it was starting to break him to see John going through this deterioration. John reaching the age of 25 was both a blessing and a curse on Harvey. John had slowly reached the point where his heart was barely beating on its own and he was barely conscious, but many DMD patients don't make it to 25 or anywhere close. However, Harvey's pain and caretaker burden had only increased in the last 6 years, and he was starting to take on considerable medical expenditures of his own, for both the antidepressants and therapist meetings that he had. Harvey had dedicated the last 13 years of his life to taking care of John, and the task had completely taken over his life. He had not gone on a date in over 8 years and had lost 30 pounds in the same time period. When John finally passed away in his sleep a few weeks later, Harvey felt that he had lost a piece of his soul. After John's funeral, he was unsure of where to go or what to do with his life, because John had been his life for so long that he couldn't remember what life had been like before. The only thing Harvey could do was to try and pick himself up and move on to another patient, because his job was still a caretaker, and this was his caretaker burden.